You might be feeling depressed or even diagnosed with depression and wondering if there's anything you can do about it. Everyone tells us to go see our doctor or go see a therapist, but what does that actually look like? In today's video, we're going to talk a little bit about what that treatment process actually looks like for people and what kind of things you can expect. Any stories shared in this podcast have had names and details changed for the confidentiality of clients. Any resemblance to someone real is coincidental. Hello everybody, thank you for joining us for today's episode. Following up with last time when we talked about being diagnosed with clinical depression and what that looks like. If you're interested, check out that video. Today we're going to talk about what does treatment for clinical depression look like. So last time we talked about different types of depression, how you might know if you are depressed or just having a hard time, a little bit of that. So let's say you go see your doctor, you go see your therapist, and they say, yep, major depressive disorder, blah, 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 specifier. What does treatment actually look like? What is your path going forward going to look like if you want to feel better?
So I'm glad that we're talking about this today because I think a lot of times people with any mental health diagnosis feel like, well, how can therapy really help me with that? Like, what can anybody actually say to me that's going to make any difference?
Or someone that cares about them says, hey, go to therapy, and they think like, okay, I'll go to therapy and that's going to fix it. But therapy it looks very different depending on what you're there for.
It does. So I would say that, obviously we're going to talk a little bit about how each of us would treat depression. And some of these things are probably going to be pretty similar between each one of us and would be similar for any therapist that you go to. But one of the things...
Refer him to Josh.
Yeah, send him to Josh.
Don't do that.
One of the things, though, that I think most therapists would start out with is something that we call psychoeducation. So psychoeducation is this piece of therapy where we kind of teach you about what it is that you're experiencing. Okay, well, so yeah, here's depression. Here's the symptoms that you said you're experiencing. Let me tell you a little bit more about this. Let me tell you a little bit more about what treatment will look like and about depression itself and about how this can get better, just so that we're talking you through some of like an overview. So that would be one of the first things that, at least when I'm meeting with somebody, they could expect.
Anything from you?
Yeah, refer him to Josh. No, I'm just kidding. Oh, partially. No, I think psychoeducation is a great place to start as far as what is this going to look like, what is depression like, those kind of things. But I also think it's really helpful to like be very validating at the beginning of people's experience and of how hard it is to be depressed and how it is overcomable also.
Yeah, so one of the key pieces is helping people recognize that this is, I think, the benefit of education. We do our best to create an environment where you can talk about it and not feel weird about it.
Yeah.
Because if it does feel weird to talk about, you won't talk about it, right? One of the things that I try and do is once you do a little bit of an overview on what depression is, what it looks like, how it might be affecting them, I like to educate a little bit on the different options for treating depression. Medication is one of those. In our world, the clinical world, there's lots of different theories for treatment. And so I like to explain to folks a little bit about what that looks like and then have them find which one they feel like might work for them. And then we start looking for potential causes of the depression. And then I'm a big behavior guy. And what that means is coming in, sitting down, and talking will do some, but then we're going to create changes in daily routines and behaviors that's designed to combat depression and increase serotonin and dopamine, et cetera, et cetera.
Yeah, I really like that approach. It's probably pretty similar, like things like opposite action and things like that. And it's probably important that we say also, this is like after we've ruled out this is not trauma, this is not ADHD, this is clinical depression, because those treatments are going to look different for sure.
Yeah.
But I think behavioral treatments is usually where I go for depression as well.
Yeah, I think that too, one of the places I start maybe after some of the psychoeducation piece and talking through some of what this looks like, I also try to help the person them and me both, figure out where on the spectrum of depression they are. because it's not that either you have depression or you don't. There's like a whole spectrum of stuff in there. And so some symptoms might be more severe whilst other symptoms might be less severe. And obviously the less severe symptoms, it's going to be way easier to make progress on those ones first than some of the more severe symptoms. So like, let's say that somebody comes into me and they do have a major depression disorder diagnosis. I might be saying to them, okay, well, let's talk about, can you feel joy in any area of your life? Okay, well, where can you and where can't you? Or if you can't at all, when was the last time you were able to? What in the past has made you feel joy? So that I'm kind of helping them and myself to understand what this spectrum looks like, so that we start heading the opposite direction. We always want therapy to be headed in the direction of making depression less severe instead of depression getting more severe. And I would say, as a human being, you're always moving towards one end or the other. There's no such thing as sitting still. So that's what we're trying to do. We're trying to help you move in that direction. So first we might like assess where it is that some of those symptoms might be most severe. And then we're going to say, okay, what kind of behavioral interventions are going to help with that? So do you guys have some examples of like behavioral interventions or what that even means?
Yeah, so in a very simplistic world, if we do an assessment as thorough as you do, which I'm not sure that I do, but if we did, if you can find periods of time where you have felt happiness, you have felt joy, you felt excitement, you felt motivated, you felt the keyword criteria is pleasure, right? Let's recreate those, right? If you
spend more time in those.
If you have found in the past that going paddleboarding is something that you have found enjoyment doing, let's find ways to make paddleboarding happen more often. Now here in Utah, that's hard to do in the middle of January, but there might be other areas. And so I would, in doing an assessment like that, I would try and recreate behavioral opportunities where they have experienced that previously. That's probably the easiest way to do that.
Yeah, I like that. I feel like that's where I usually start with people also, and then maybe like another step past that, or even sometimes in place of that, depending on the situation. I try and help people understand this principle of like, if you do all the things a depressed person would do, you will feel depressed. And so I always think of like when a client will come in very depressed and they'll tell me things like, you know what, I really just need to like take a couple months off of work and figure my stuff out. And I'm like, no, that is the opposite of what you need to be doing in most situations.
In most situations.
It's, if you were feeling better, you probably wouldn't mind going to work, hopefully, and keeping some kind of routine and structure and going out with friends and those things. And so sometimes the behavioral treatment of depression looks like a little bit of fake it till you make it, and just forcing yourself to, you know what, if I felt better today, I would probably have gone for a walk. So I'm going to go for a walk. I maybe don't want to, but by thinking of that cognitive triangle, right? Like our actions affect our feelings, affect our thoughts, and so on and so forth. Sometimes if we just change our actions, it's going to change the way we feel rather than waiting to feel better to change our actions.
Yeah, and I think that sometimes I feel like it almost feels a little invalidating to hear that, because it's like, no, you're not getting it. I really am depressed. And that really is true. But I would also say, if you're laying in bed all day with the blinds closed and there's not a lot of noise and
no social interaction,
and you stayed up really late and now it's way late into the day and you're still laying in bed, what is the opportunity for you to feel better? There's not an opportunity. And so some of this is like, we have to create opportunities for you to feel better. And like you said in the beginning, it is kind of some of that fake it till you make it kind of stuff. And it is finding small places that you can do that, because if you've been in a pattern of laying in bed until noon every single day for the last 6 months, and now we're talking about we want to help you feel better, like, you're not going to be able to just switch it all up in one day.
For sure.
Right? We're going to have to find little behavioral interventions along the way that will provide an opportunity for you to feel better.
Yeah, and I think it can feel invalidating sometimes, and I assume most therapists, myself included, try their best to be, hey, look, this is the intervention, but I get that this is going to be really, really difficult because you've been laying in bed for 3 weeks straight. So this is going to be really hard, but let's get some small wins. And that's how I try and frame combating depression is you're setting yourself up for lots of situations where you feel like you're failing or not succeeding. So let's give you opportunities to win, to succeed, that are really easy and small. Like maybe it's just that you got out of bed at 11 instead of 12 and you made your bed. And if that's all you did that day, great. That's fine. That's a step in the right direction, right? You talk about momentum and we're always moving one way or the other. Let's just start taking baby steps in the direction of doing things that I would do if I was feeling better.
Yeah, there's a lot of research that demonstrates that clinical depression will affect the reasoning portions of our brain. And so that's why I think a lot of the modalities for treating clinical depression are challenging belief patterns, because you end up getting in a position where you see your situation from a very concrete perspective, and it's really easy to learn that going for a walk won't help. I find on weekends, if I just put my phone down and leave it somewhere, gosh, I feel so much better. Not that I spend a whole ton of time on it anyways, but it can be very easy to feel like, well, I don't have anything to do, so I might as well be on Instagram or whatever.
Yeah, and I don't always want to put my phone on. I kind of like having my phone around.
Yeah. And so I think post psychoeducation, we talk models, we apply a model, we're absolutely going to challenge thought processes, whether it's cognitive therapy or a different kind of therapy, right? We're going to do behavioral interventions, and then it wouldn't be Josh if I didn't mention it, but there does come a portion where as we try these things, it may be worth exploring medication use. That is sometimes a cognitive intervention that we have to do and a behavioral intervention that we have to do. And a lot of the research shows that if we do meds and therapy at the same time, the outcome is even better.
Yeah.
Right. Well, and again, a lot of it is about gaining that momentum. You got to get moving in the right direction so that this can start to get better. And then maybe down the road, maybe you don't have to continue taking the meds, but you've got to get some things to shift so that you can switch the direction that this is
Get
headed.
rolling in the positive direction.
Right. And I know that, like, I've had some people say to me before, like, there's no way this could get any worse. Unfortunately, I would say depression can pretty much always get worse. And so I know that's like a little bleak.
Yeah, thanks, Sarah.
You're welcome. But I mean, it's just honest, right? And so there is no way to sit stagnant if you have to have some medication or try some small behavioral interventions or challenge your thoughts to get you headed in the right direction. That's just what has to happen. And that's how therapy can help you.
Yeah, I like that. Well, thank you everybody for joining us. Hopefully some of this was helpful. If you do feel like you're depressed, go talk to a therapist or talk to your doctor. There is help available, and there is lots of research proven things that can help you feel better. Sometimes it just requires taking that uncomfortable first step. So thank you for joining us, and we'll see you on the next episode.
Thanks.
Bye.
If you enjoyed today's video, please like and subscribe. Thank you so much for watching. We've got other videos for you to check out and more exciting things coming soon.